bathing the patient. Refer to the medical record or care plan for special interventions. Assemble the necessary supplies: 2 bath towels, 2 washcloths, a wash basin, soap and soap dish, bath blanket, gown or patient's own pajamas or nightgown, hygiene articles such as lotion, powder, and deodorant, laundry bag or hamper, and disposable gloves. Introduce yourself and perform hand hygiene as appropriate, don clean gloves.
Okay, so I would have gathered my supplies, knocked on the patient's door, seen if it was okay for me to come in, introduce myself. Hi, my name is Daniela. I'm going to be your student nurse. Wash my hands. Okay, can you please tell me your name and date of birth? So I'm coming to my patient, making sure that what they say is correct. Do you have any allergies? No. Again, I could go more specific. Soap, latex gloves. Okay, I'm going to don my gloves. I'm going to inform my patient of the procedure that I'm going to do. Mr. Liu, I am going to give you a bed bath.
Prepare patient for interventions. Close the door or pull curtain.
Okay, so I'm going to come around. I would have pulled my curtain for privacy. All right.
Suggest use of a bedpan, urinal, or bathroom.
Mr. Liu, do you need to go to the restroom before we start? No? Okay.
Arrange supplies.
So I'm going to put this is where my dirty linen's going to go. I'm going to make sure it's not on the bed, on the floor. I'm going to put it on this bedside table because it's not being utilized.
Adjust room temperature.
Okay, I'm going to adjust the temperature to make sure you're comfortable during the bed bath.
And raise bed to a comfortable working position.
Okay.
Lower side rails. Position patient on side of bed closest to you.
Okay, so I'm going to raise my head, I'm going to raise the bed up, but if this patient was positioned in another position, like a side lane, then I could lower my side rail, position her into a supine position. Okay?
Loosen top linens from the foot of the bed. Place bath blanket while you remove the top linens. If patient is unable, you need to hold the bath blanket in place while removing linens.
Okay, so I am going to loosen the bottom portion of these linens. I'm going to put my bath blanket on my patient. Mr. Liu, I'm going to put this on you because I'm going to remove your blanket, and I'm going to make sure that I'm providing privacy for you, okay? Okay, so I'm opening it up. Mr. Liu, can you please hold on to your bath blanket or the bath blanket so that way it won't expose anything while I pull down the top linens? He can't. So I'm going to try my hardest to hold on to the top linen or to the bath blanket while I'm removing the blankets, making sure that it doesn't touch me, and making sure that I'm still providing privacy for Mr. Liu. Okay, so I've gathered this, making sure it doesn't touch me, and I'm just going to discard of it in the bag. All right.
Assist patient with oral hygiene. If patient is unable, the nurse performs the procedure.
Okay, Mr. Liu, we're going to perform oral hygiene. So we did it.
Remove patient's gown, all undergarments, and jewelry. If an extremity is injured or has reduced mobility, begin removal of the gown from the unaffected side. If the patient has an IV tube, remove gown tubing from pump slide gown covering down over the affected arm and over tubing and container. Rehang IV container and check flow rate or reset pump. Do not disconnect tubing.
Okay, so I'm gonna hold my patient's medication. This patient is on an IV. So I'm gonna bring it down. Now, if your patient had the little snaps on the gown, you could just unsnap it. We're gonna pretend like our patient doesn't. So I'm gonna bring it. I'm gonna put it, work its way up throughout the sleeve so it comes out through the top. And then I'm gonna rehang it, put it back into the IV pump and make sure that the settings are still the same. And start it up again. And now I am ready to remove the gown. Again, making sure that privacy is still being held. Okay, Mr. Liu, we're almost gonna start your bed bath. If I would have being that I would walk away, I would lower it down. Okay?
Raise side rail and fill wash basin 2/3 full with water at 110 degrees Fahrenheit to 115 degrees Fahrenheit.
All right. So being that I'm gonna walk away, I'm gonna remove my gloves, discard of them in the trash can, lower my bed down to the lowest position so that way my patient doesn't attempt to get out of bed or fall. I'm gonna come over here, prepare my water, make sure it's good, have my patient feel it. Mr. Liu, can you feel it? Is it comfortable? It's comfortable for my patient. Okay, so I'm gonna don my gloves again, bring my patient's bed up. Okay.
Remove pillow and raise head of bed to semi-Fowler's position if patient is able to tolerate.
Okay, Mr. Liu, I'm gonna remove your pillow, okay? So we don't get it wet. Okay. I'm gonna pick up the head so he's able to tolerate this better. I'm just place my pillow to the side. Okay.
Form mitt with bath cloth around your hand. Dip mitt and hand into bath water. Squeeze out excess water.
Oops, sorry. Okay, so I'm gonna make a little mitt. This is not with any soap. I'm gonna do the eyes with different sections of my washcloth. So I'm gonna go from the inner canthus out. From this one, inner canthus out. And then I can start washing his face, or again, it's not with any soap on it, just that way it won't irritate the eyes. I can do the ears for the peanut. I can do a Q-tip, or yes, a Q-tip or a cotton tip applicator. And I'm also gonna do the neck. Okay, so after I've done that, now I'm gonna dry. I'm gonna pat dry. And then I can do this. Okay, so we're done with the face.
Expose arm farthest from you. Place towel lengthwise under patient's arm.
Okay, Mr. Liu, now we're gonna do the arm. Being that this skill takes a while to do the whole body, we're only gonna do half, and we're gonna show the half closest to us. So, Mr. Liu, I'm gonna expose your arm. I'm gonna put this towel lengthwise under your arm, and this is so that way your bed won't get wet. All right.
To cleanse the hands, the nurse can place wash basin on towel and place patient's hand in basin of water, or the hands can be cleansed with the washcloth.
Okay, so I'm gonna wring out the excess water. You don't have to worry about making a mitt, but this time we are gonna make sure we do add soap. So I'm gonna wash the hands, making sure I get into any making sure I get in between the fingertips, around. If nail care needed to be provided, I would provide it. Okay, so I wash the hand. Now I'm gonna go up the arm, and I'm gonna go up the arm in long, firm strokes to decrease any chance of my patient getting tickled. So I'm gonna go up, and make sure again, you know, I'm lifting this up and getting behind and I'm supporting. Okay, so I did the arm, I washed it. I'm also gonna do the axilla. So I'm gonna go, I washed it. Now I'm gonna rinse it again and getting in between the areas, the fingertips, going in long, firm strokes up, under the arm. And now I will pat dry my patient. I can use this one or I can use this other one. So I pat dry my patient's arm. I wouldn't have dropped my deodorant. And if necessary, I can ask my patient, Mr. Liu, would you like some deodorant? Yes, he would. So I'd apply deodorant. And now we're done with the arm. After we're done with the arm that was supposed to be farthest away from us, we change out our water and we do the arm closest to us and repeat. Okay, so now we're done with the arms.
Cover patient's chest with bath towel. Fold bath blanket down to waist and wash chest with circular motion.
Okay. So prior to this, would I have changed my water?
Yes.
Okay, thank you. So we did this. We're gonna make our little mitten with our washcloth, add some soap, go into a circular motion, and slowly be exposing our patient, okay? Now, if this patient had breast or any kind of folds, we wanna make sure and raise and make sure we go under them. Okay. All right, so we washed it. Now we're gonna rinse it. And then we can pat dry.
Continue to observe the condition of the patient's skin, degree of mobility, and behavior. Encourage the patient to verbalize concerns.
Okay.
Fold bath blanket down to pubic area, keeping chest covered with dry towel. Wash abdomen, including umbilicus and skin folds, dry thoroughly.
Okay, so now I'm washing the abdomen. If they had any folds, I would have gone under. Make sure I washed everything. So I'm washing, rinsing, again under the folds, and then I'm gonna pat dry, and I'm gonna make sure that I get under those folds, noting anything, okay, any redness. All right, so we've done the chest and the abdomen.
Raise side rail and empty basin into hopper or stool. Rinse basin and washcloth. Refill basin 2/3 full with water at 110 degrees Fahrenheit to 115 degrees Fahrenheit.
Okay, so Mr. Liu, I'm gonna have to change my water, okay? So I'm gonna remove my gloves because I've already performed that care. I'm gonna raise my side rail, lower my patient's bed. I'm gonna get another set of gloves on because I'm gonna rinse out these towels and I don't wanna be touching them with my bare hands. So make sure before I stepped away, bed was low. Let me go rinse out. I would have disposed of my water in a hopper, rinsed out my washcloths, got a new set, make sure it's okay, make sure my patient says it's okay. All right.
Expose leg farthest away from you, keeping perineum covered. Place bath towel length side on bed under patient's leg. Place wash basin on towel and place patient's foot in basin.
Okay, so Mr. Lou, I'm now gonna wash your leg, and again, it would have been the leg farthest away from us. So I'm gonna put his leg, do that, making sure I'm not exposing more than what needs to be exposed. Now, if my patient is, if it's possible, and I need to wash the foot, I can bend the leg, bend at the knees, supporting the heel, and then I can put in here, okay? But we're just gonna wash with just the washcloth, the feet, all right? All right, so now we're washing the toes, we're washing the feet, making sure, getting in between the toes. And making sure if this is any kind of diabetic patient, we're paying special attention to their feet. Okay, so I've washed the feet, now I'm gonna go to the leg.
With long, firm strokes, bathe the leg. However, note that bathing the lower extremities of patients with histories of deep vein thrombosis or hypercoagulation disorders with long, firm strokes is contraindicated. Use circular, gentle strokes for these patients so that the clot is not dislodged.
Okay, so I did firm strokes because we're gonna say our patient doesn't have a clot, but if they did, then I would have used circular strokes. Okay, so I've washed it. Now I'm gonna rinse it. Again, making sure I get in between those toes. And then done the long, firm strokes up for my patient. Making sure I get, always make sure when you're checking off, you get under the leg, okay? And then I'm going to pat dry. Making sure I do real good on drying these toes. All right.
If skin is dry, apply lotion if desired. Do not massage legs, never massage lower extremities. Bathe the leg and foot closest to you and repeat step R. Raise side rail, be sure patient is covered with bath blanket. Be certain to expose only those body parts being bathed. Change water, lower side rails if patient tolerates position, prone or in Sims position.
Okay, so I'm going to remove my gloves because I've already done everything. My side rail was already up because I was working at this lower section. I didn't have to go over my side rail. So it's up. I would have put my bed in its lowest position because I am, again, walking away from my patient. I'm going to don another set of gloves because, again, we are disposing of this and rinsing our washcloths. Okay, so we're going to go to the sink after we've already disposed of the water in the hopper. Getting a new set, rinsing our washcloths, okay? Testing it, making sure our patient tests it because that it's still okay. All right, and now we're gonna put our patient in a prone position because we're now gonna do the back, or in a Sims position. So we're gonna turn. Mr. Lou, can you please turn to your side or help me turn to your side? Okay, so we're gonna get our patient again. Turn them to their side. Oops, sorry. Okay, I'm gonna come around and we're not gonna push our patient away from us. We're gonna bring the patient towards us. Okay? Making sure everything is still covered for our patient. We're just going to say that this patient can assist and can hold on to the side rail. Sorry. Okay, they're not going to have their face smush into the side rail. We would have put something. Okay. So now what?
Place the towel lengthwise on bed along back. Wash and dry back from neckline down to buttocks. If patient tolerates a massage action, do so while washing back.
So now we're going to wash the back. So I got this ready, got my soap on here. Mr. Lou, I'm going to wash your back in circular strokes. All right, so I washed it. I'm now going to rinse it. Okay, and pat dry. All right.
Reposition patient supine. Provide basin of water, soap, washcloth, and towel, and instruct patient to cleanse perineal area. If patient is unable to finish bath, don new gloves and complete this aspect of patient care.
Okay, so also at this time, being that I'm back here, I could give him a little massage if he wanted. We're gonna assist him back into their regular position, which is they're on their back. Okay, so this is the time when we would ask them, Mr. Lou, can you provide, can you freshen yourself up? And being if the patient doesn't know pericare, we can say down there, or freshen yourself up where you became incontinent. They can't, then we would be providing pericare to a male or a female, that's your patient. All right.
Be certain patient is covered with blankets, raise side rails, empty water basin, and replace basin in bedside stand. Place washcloth and laundry bag for soiled linen.
Okay.
Assist the patient into a clean gown. If ordered, assist patient to ambulate to chair. Place towel over shoulders and comb hair.
Okay, so I'm gonna put my new gloves on. We're already done bathing, so I would dispose of my used washcloths. My patient's side row was up. My bed was put in the lowest position because now I'm gonna rinse this out, or dump it in the hopper, rinse it out and dry it. Put all my patient's stuff in it. Put it in their area because it is theirs, and I'm gonna assist them into the gown. Okay. Or their pajamas. So with this, it's gonna be the same way. We're gonna assist them on the arm that was not restricted. So we would have put it like this, or if they have an IV, we're gonna have to go to the IV side. Okay, so Mr. Lou, we're now gonna put your gown on. So we can put the gown on top of our patient. Again, we would have had to hold the medication, bring this down, take it out of the pump. We can either already bring it through, or we could have put the patient's arm in first and brought it through. So let's put our patient's arm in first. Okay. Now we're gonna put it through. Again, we were gonna hang it up. Put it back in, make sure once we've closed the IV pump that the setting is still the same, and restart it. Okay, so we'll push run. We've done this side, bring our side rail up because we're switching over to the next side, and put his other arm in. Mr. Lou, now let's put this arm in. Okay. And we can tie it if we need to in the back. All right.
Place all soiled linen into laundry bag. Be certain all bath equipment is clean and put it away as necessary.
Okay, so I'm gonna remove this bath blanket, making sure my patient is still covered. Privacy is still held. Okay. All right, so my patient had a bed bath.
Place call light in reach. Position patient for comfort and provide warmth. Remove gloves if wearing any. Discard them in proper receptacle and perform hand hygiene. Maintain a neat and clean work area.
Okay, so I know my patient isn't covered yet, but this is when that skill of making an occupied bed will come into play. So we'll just assume, or we'll just say that he's covered, he's in a comfortable position. I've given back his pillow with a clean sheet on it. Okay, Mr. Liu, let me assist you. Okay, so he's comfortable. My side rail is up. My call light is within reach. I made sure it was working. I made sure my patient knew how to use it. Again, my patient's covered. Bed is in the lowest position. I'm gonna remove my gloves. Wash my hands. Make sure my area is clean. Make sure all his belongings are close to him. His table is close to him. Okay.
The partial bed bath differs from the bed bath only in that the patient does not need assistance bathing many anatomic regions. Help by bathing those areas that the patient cannot reach. Feet, back, and perineal areas. All steps of the bath are followed, and the same considerations prevail.
Okay. So with my partial bed bath, it pretty much is the dirtiest areas: his feet, his hands, his underarms, his peri area. I'm gonna see if my patient needs anything prior to exiting out of the room. I'm gonna take my soiled linen. Okay.
Document type of bath, water temperature, and solution used when appropriate. Duration of treatment, level of assistance required, conditions of skin, and any significant findings. Vital signs before and after, patient's response, and patient teaching.
Okay, so in this, I also would have checked his ability to help me, let me see, what else is there? His tolerance of his activity, his level of discomfort, if he had any kind of pain and when I was repositioning the patient, his musculoskeletal function, which is pretty much his extent of his range, the joint range of motion, his knowledge of importance of the skin hygiene, also if there were any kind of skin abnormalities, any rashes, bruising, swelling, anything like that, I'd go and document. And also his vital signs and his cognitive ability. Okay, that's it.